नमस्ते एवरीवन। डॉग फ्लिक के सिंपली गुड हेल्थ के एक और नए एपिसोड में आप सभी का स्वागत है। मैं हूं आपकी होस्ट डॉक्टर ममता और आज हम एक ऐसे हेल्थ इशू या हेल्थ कंडीशन के बारे में बात करेंगे जो कि कई बार कई अलग-अलग सिम्पटम्स लेकर आता है और हम में से कई लोग इसे लेकर कंफ्यूज्ड हो जाते हैं कि एग्जैक्टली इसके सिम्पटम्स क्या है और इसे मैनेज करना है। सो मैं बात कर रही हूँ आईबीएस यानी कि इरिटेबल बाउल सिंड्रोम की। और हमारे आज के एपिसोड का नाम है हेल्दी गट हेल्दियर यू। सो लाइक आई सेड कि आईबीएस के बारे में हम काफी ज्यादा कंफ्यूजन रहे, काफी मिसकंसेप्शंस रहते हैं और हमें सही गाइडेंस की जरूरत रहती है, स्पेशली जब न्यूट्रिशन की बात आती है और हमें पता ही नहीं होता है कि क्या खाना चाहिए क्या नहीं खाना चाहिए, और जो कुछ भी खाना चाहिए वो कितने मात्रा में खाते हैं या कितने फ्रीक्वेंसी से खाना चाहिए। तो इस विषय में हमें गाइडेंस करने के लिए हमारे साथ आज जुड़ी है प्रख्यात न्यूट्रिशनिस्ट फोरम मालदे। फोरम जी को 15 इयर्स से अधिक अनुभव प्राप्त है और इन्होंने अपने एक्सपर्टीज से कई सारे न्यूट्रिशनिस्ट को ट्रेन किया है। इनका स्पेशल कंट्रीब्यूशन रहा है इन मैनेजिंग डाइट एंड न्यूट्रिशन फॉर पेशेंट्स विद डायबिटीज, स्पेशली टाइप 1 डायबिटीज, as well as patient with kidney issues and pediatric patients. Forum ji, we are honored to have you guiding this session today.
Thank you so much, Mamta.
Yeah. So before we begin this session, I would like to tell our audience कि आपके जो भी questions होंगे IBS के विषय में लेकर या उसके न्यूट्रिशन के विषय में लेकर, आप उन्हें पोस्ट कर सकते हैं कमेंट सेशन में. They will be addressed by Forum ji towards the end of the session. So let's begin our session for today. So to begin with, for our viewers who may not be very familiar ki what is IBS, can you give us a quick overview of what IBS is and इसके typical symptoms क्या होते हैं?
For sure. तो IBS यानी इरिटेबल बाउल सिंड्रोम एक ऐसा कंडीशन है जहाँ पे यू हैव सम एब्डोमिनल डिस्कम्फर्ट, जैसे यू विल फील चेंजेस इन योर बाउल हैबिट्स, या कभी पेट साफ होता नहीं है या होता है तो बहुत ज्यादा होता है. सो इन दैट सेंस यू विल गेट सम सिम्टम्स लाइक गैस, ब्लोटिंग, डायरिया, कॉन्स्टिपेशन. और बिकॉज बहुत सारे वेग सिम्टम्स हैं तो इसको अगर डायग्नोस भी करना है तो हम एक्सक्लूजन से करते हैं, यानी कि if there is no other condition applicable, then usually we conclude that it is IBS.
Okay, मतलब एक पर्टिकुलर ऐसे कोई सिम्टम है ही नहीं कि जिससे हम बोल सकते हैं कि ये आईबीएस का सिम्टम है. कोई भी सिम्टम हो सकता है और वो आईबीएस की तरफ लेकर जा सकता है, और ऐसे भी हो सकता है कि कोई सिम्टम है बट इट इज नॉट आईबीएस ऑल्सो.
Yes.
So yes, so basically IBS, to summarize it, vague symptoms रहते, कुछ भी सिम्टम हो सकता है इसमें.
Absolutely.
Yes. Now another thing is ये एक काफी कॉमन कंसर्न है इंडिया में, बट हम ये भी देखते हैं कि देयर इज अ लॉट ऑफ कंफ्यूजन अराउंड इट. So let's clear the air. What are some of the biggest myths you've come across about IBS?
To talk of, so simple myths we'll pick. थोड़े से सिंपल चीजें उठाते हैं, जैसे कि लोगों को लगता है IBS बहुत ही ज्यादा सीरियस कंडीशन है. सो IBS में साउंड कि बहुत सारे सिम्टम्स होते हैं एंड दैट कुड बी फेटल, बट एक्चुअली इट इज नॉट फेटल. इट इज normal, you can treat it. घर पे ट्रीटमेंट हो सकता है, maximum you can take a little medication from your doctor and treat it. So it is not very fatal like many other conditions which we see in our day-to-day conditions list. The other thing is कि people think IBS हो गया तो अभी कुछ नहीं हो सकता, there is no treatment, वो जिंदगी भर you'll have to live with it. Actually, it is not. You just have to change your lifestyle a little, dietary habits, थोड़ा stress को change करना है या उसको manage करना है. Rather stress you usually cannot change, but manage करना पड़ेगा. And sometimes medications are needed, so you have to go to your doctor for it. But वो जो symptoms बहुत ज्यादा आते हैं उसको हम कम कर सकते हैं. So that is one myth. And one very common myth which comes to me is कि IBS है तो अभी हम खाने में कोई स्वाद नहीं रख सकते, कोई स्पाइसेस नहीं ऐड कर सकते, which is quite untrue. For every person, the tolerance level of spices to be added is different.
That means spice allowed जरूर है, but then again you need to keep a watch on the amount of spice that is being used in your diet. Right.
Yes.
So, okay. So when we come to certain Indian foods and drinks, so there are certain foods which seem to be triggering IBS symptoms. So can you share some insights on this?
Firstly, triggering is very individualized. So every patient that comes to us has a different trigger altogether. Now, for a few people, eating a very large meal, suppose I've had a very big meal, will be a trigger that, okay, after that, I feel all the symptoms of IBS. For others, it could be I've had a very high fat meal, though the meal may not be very big, but I have had something fried and that has caused me something like an IBS symptom. Sometimes caffeine, a simple 2, 3 extra cups of coffee in a day also can do that. Milk, if there is an intolerance towards milk, it can cause those symptoms. Fructose, especially if you talk about labeling a few packaged foods, which we use over the counter, we have ready to eat foods. उसमें जब fructose की मात्रा बहुत ज़्यादा होती है, तो then that also can actually lead to IBS symptoms. And even alcohol can cause it.
Okay. तो फोरम जी व्हेन वी स्पीक अबाउट दिस फूड्स जो ट्रिगर करते हैं आईबीएस, तो आपने जैसे कहा, फ्रॉम व्हाट आई अंडरस्टैंड फ्रॉम दिस इज कि एक इंसान को अगर सपोज मिल्क ट्रिगर कर रहा है, तो इट डजंट मीन कि वो किसी और को भी मिल्क ट्रिगरिंग फैक्टर हो. सो डज इट मीन कि फॉर मी इफ मिल्क इज नॉट सुटेबल, इट मे बी सुटेबल फॉर समवन एल्स?
Yes, it can be. So when we talk about lactose intolerance, or that milk is not being suited for a few people or something like that, for A person, if you say what is applicable, for B person it will not be applicable, and there could be varying degrees. मतलब कि एक one patient को 100 ml milk सूट करता है, एक को 1 लीटर से भी कोई प्रॉब्लम नहीं है, और एक को थोड़ा 2 चम्मच भी कहीं पे आ गया तो that could be a problem.
फैक्टर का हम जब मेंटेन करते हैं, so hello.
Yes. Yes.
Uh, yeah, I think there was a loss of connection. So I would just repeat my question. तो मैं पूछ रही थी, are there any specific food groups जो in general IBS को trigger करते हैं, and it can trigger symptoms in everyone?
Actually, in general, नहीं है. So, like we say ना कि one man's meat, another man's poison, ऐसा हो सकता है. So, somebody may tolerate fiber, somebody may not tolerate fiber, somebody may tolerate milk, a few may not. तो सबका अलग अलग होता है. उसके लिए you have to start. But there is a huge list, but exhaustive list, जिसमें से कुछ चीजें हो सकती है, कुछ चीजें नहीं हो सकती है. So you have to start by eliminating everything. एंड देन एड वन टू अंडरस्टैंड कि आपको कौन सी चीज से ट्रिगर हो रहा है.
Okay. Now, given the fact that India में there is a big diversity when it comes to dietary habits, so could you give some tips on managing IBS in particularly in the Indian population? And are there any simple tips that you could recommend for this?
Sure. So, Indian foods usually we will talk about more so with the spices content, because that's very different from what we'll see from our other counterparts. तो जब भी spices की बात करें तो you should introduce one first eliminate all the spice, फिर बाद में एक एक spice introduce कर सकते हैं, and then you have to also test the level of the spice. मतलब कहाँ तक तीखा चलेगा, कहाँ तक मसाला चलेगा, कहाँ तक दालचीनी, all our spices basically, how much will they work? पेपर है, दालचीनी है, रेड चिली पाउडर है, ग्रीन चिलीज है फॉर दैट मैटर, ये सारे भी कितने चल सकते हैं और कितने नहीं, डिपेंड्स ऑन आवर टॉलरेंस फॉर एवरी पर्सन. देन इफ यू टॉक ऑफ मिल्क ऑल्सो, मिल्क की भी काफी वैरायटीज मिल जाती है इंडिया में. तो इवन दैट, हाउ मच यू टॉलरेट, विच टाइप ऑफ मिल्क यू टॉलरेट, वो सब अलग अलग होता है. एंड देयर इज ऑलवेज अ सब्स्टिट्यूट फॉर एवरीथिंग.
Right. Now, another thing is that fiber is believed to be good for IBS management. But then there are people who suffer from bloating with fiber intake. So, can you shed some light on how to manage fiber intake for IBS patients?
Yes, so fiber is a double edged sword sort of a thing. कि क्या होता है जब फाइबर लेते हैं हम, ऐसा है कि excess fiber is also digested towards the end of your colon, because it's not digested in the initial part of your digestive system. So इसकी वजह से ये होता है कि your bacteria, the good bacteria in your gut, fermented lower, and उसका जो रीजन है उससे थोड़ा सा ब्लोटिंग, एक्सेसिव आईबीएस के सिम्टम्स आ सकते हैं. तो कौन सा फाइबर लेना है? तो सिंपल आंसर इज यू हैव टू टेक अ सोल्यूबल फाइबर. Now, if I say soluble, what do you mean by soluble? So, soluble fibers are fibers which you get from some peeled fruits, or you'll get it from, say, oats, for example, or you may also get it from some amount of fiber supplements, which specifically categorize as a soluble fiber supplement. So, you have to ask your nutritionist for specific sources of soluble fiber first to try. And then if you want to try the roughage, the other type of fiber, then you try with some small amounts and see how much is tolerated.
So, Forum ji, when we spoke about foods that trigger IBS, वहाँ पर हमने mention किया about lactose intolerance, and also about the amount of milk, vary करता है कि कितना milk may trigger the symptoms. तो coming to this aspect, for people who suffer experience lactose intolerance,
Yeah, so a few foods that we can recommend for lactose intolerance would be that, first of all, a curd which is non-refrigerated. Sometimes if you refrigerate a curd earlier on, what happens is कि उसका lactose रह जाता है, and thereby what happens is you end up actually triggering the symptoms. So maybe a curd which is actually set outside. The other could be, you could use some coconut milk, you could use almond based milk, you could use soy based milk. All these options are today available in the market. They can be homemade, they can be packaged, both. Yeah, sure. Dr. Mamta is seemingly having some technical issues. She's joined us back. So until then, I would just like to tell you in general about FODMAPs, which is one very important part of our IBS diets. Now, usually FODMAP, if I tell you the full form, is a fermentable oligosaccharide, disaccharide, monosaccharides, and polyols. Ye, these group of foods are the ones which are usually avoided the list of foods when you talk about IBS. When these undigested food maps reach the large intestine, they impact our gut bacteria and cause digestive issues for us. It could be constipation related, bloating, gas, pain related, or diarrhea related. So it could give rise to a different set of symptoms for every person. When you talk about FODMAP diets, first, it's like the elimination sort of a diet, but there is a huge list of foods you need to first eliminate full amount. Then you start by introducing a very small amount of each food. And then to improve the symptoms, you have to first see that you have not had it for 6 weeks. After that, you have to introduce a little by little and then see whether that little is causing any symptom or no. And then you will have your tolerance limit. That also includes fructose. It also includes all your vegetables, a few vegetables which also come into it, and a lot of times packaged foods. So you have to try all those which you regularly use and then work around it. And also one more thing which is very important when you talk about FODMAP is that you have to also look at the sweetening agents, etc. in label foods.
Hello.
Yes, ma'am.
Yeah, I am extremely sorry for them. There's some technical error happening at my end, I suppose.
No issues. We finished FODMAP until then, so we could go
Okay.
up to the next theta.
Okay, fine. So, moving ahead now, patients often ask about managing IBS flare-ups when they are eating out at restaurants. So, can you offer some strategies on this?
Yeah, sure. So when you eat out, you have to be careful of what you're ordering. So especially when you choose simple dishes, like say grilled chicken, steamed vegetables, or grilled veggies also, or sizzlers, or something which is very simply cooked, no complex cooking or frying or excessive processing, then that usually doesn't show a IBS flare. Also, avoid the ingredients in the FODMAP list, which you've already identified, are not tolerated by you. Now, sometimes if you're still in an acute phase, we have not recovered, etc., you can ask your doctor if there are some digestive enzymes that could be recommended or some probiotics, etc., which can be recommended also when you're going to eat out specifically.
Okay, so we move from diet to exercise, another lifestyle aspect. So, can exercise help manage IBS? And if so, what kind of exercise would you recommend?
So any kind of lifestyle, because IBS is also related to our lifestyle, it does help. So exercise definitely helps improve your gut health because it also manages stress to some extent. The hormones released while you exercise, help alleviate your stress, etc. But when you're choosing the exercise, you have to start with very low impact exercises, something as simple as walking. And if you've been regularly doing walking, then you can start adding maybe some swimming and maybe yoga, all the simple things. When you want to do something like weight trainings, etc., you have to start slowly, gradually, and see how much is tolerated by it, and then implement.
So, are there any specific types of exercise that you would recommend?
Types would be mostly, aerobic at the initial part, and then going on to weightlifting, etc., which could be little while later after you test your tolerance to it. Or if you're used to it, then maybe it can be faster.
Okay, so high intensity exercise is not recommended in patients with IBS.
Not in the initial phase when you have an acute condition, etc. But when you have actually started introducing it after your acute phase, you can go up to your high intensity. In fact, it will be like a normal individual only, but you should slowly, let your body take it slowly and then reach your optimum level.
Okay. Okay. Now, many patients with IBS experience either constipation or diarrhea. So, are there specific dietary recommendations for each type of IBS?
Yeah. So now, if you talk about both, let's talk about constipation first. When you talk of constipation, then we had spoken about soluble fiber. So you need to add, whatever amount of soluble fiber you've been adding, you have to add more than that. And then you have to also drink a lot of water. Now, fiber, when it binds with water, is the effect when constipation is relieved. So that you have to do. If you cannot consume too much of fiber, a fiber supplement is also something which you can add, but you need to ask experts for it. Don't try doing it by yourself. How much, when, what time, all that you can ask an expert and then add the supplement. So that would help constipation. Now, when we talk of diarrhea, for diarrhea, usually probiotics help. Simple curd rice sort of a diet, or even plain toast or plain banana, depending on your medical conditions, you can actually help during the diarrhea phase. The most important thing with diarrhea is to have fluids at regular intervals so that the sort of dehydration which occurs as a result of diarrhea should not happen. Obviously, spices have to be eliminated for that short span of diarrhea that you have.
So, diarrhea के context में there is also one BRAT, BRAT, that we have heard about. So, could you explain what it is?
So B stands for bananas, R stands for rice, A for applesauce, and T for a toast. So these were the specific foods that people had tried during diarrhea, and 80% of the people had no symptoms of diarrhea, or could digest that sort of a food after having diarrhea also. So that's why they name it the BRAT diet, foods which would be allowed during diarrhea.
Okay. Furamji, you just mentioned about probiotics, and probiotics we know, seems to be a hot topic when it comes to nutrition or nutritional management of any condition. So, can you explain how probiotics might be helpful for IBS and recommend some good sources of probiotics?
Sure. So, first we'll start with what is probiotics. Any live bacteria which is there in your food, which is the good bacteria, which helps you in your digestion, etc., is called a probiotic. Basically, our gut has a microbiome, which is a good microbiome, and it is helpful to us. Now, if you have a huge, vast community of microbiomes which are good, and if you increase that good community, basically you will get a very healthy gut. So there are a few probiotics. One is all our yogurts and curds, which have live cultures, which are usually not the preserved types, which have not killed the bacteria in them. Yes, those can be used. Nowadays, because we have outside cuisines also coming in, so we have a lot of kimchi, which is used in the Korean dishes, which is quite famous nowadays. So that also could be something which can be added in the diet as a form of a probiotic. Then we have some kefir, which is a milk drink, which has bacteria and yeast both. We could also try some supplements, but those supplements over the counter have to be used with caution because they have huge amount of probiotics. So you have to talk to your doctor or your dietitian in specific, tell your history, and then take those supplements.
All right. So, to sum this up, हमने अब तक जितना डिस्कस किया, IBS, where we started was that IBS symptoms can be vague, can be varied. They will vary depending on person to person, and accordingly उसका जो flare up करने वाले जो भी foods है, the triggering factors, they also can vary, and their amount at which the flare happens, or the symptoms are triggered, can also be different for each person. अगेन जो restrictions लोगों को लगता है कि spice will be completely a no for me if I'm diagnosed with IBS, or maybe there'll be too many restrictions. So that is not really true. Certain changes can really help.
Yes.
Yeah. So limitations may, and then certain modifications in diet can be really helpful when it comes to, living with IBS and managing the condition nutritionally.
Yeah.
That being said, Foramji, one thing that, we would say is, before taking any supplements, it is definitely important to take advice from doctors, and then make the choices accordingly. So we have certain questions from the audience now. So we move to
Sure.
that. When we talk about IBS, we usually hear people mentioning IBS flares. How is an IBS flare different from people dealing with it chronically?
So when you talk of a flare, it's an acute time of that disease. So you may be experiencing extreme symptoms, whether it is bloating, constipation, or whether it is diarrhea, to an extent that it hampers your normal working time. Like to activities, it will happen. Whereas chronically handling, the symptoms are a little milder. Not that it becomes easier, but people learn to live with it in that chronic phase.
Okay. Our next question is Yakult any good?
Yeah, Yakult does have the live strain of bacteria. So yes, it is good. It does have the probiotics, which we were speaking about for IBS. So it has been shown to actually reduce symptoms in a few individuals.
Okay. Our next question is, what is the difference between IBD and IBS?
Sure. So both are different conditions. IBD is inflammatory bowel disease, which includes Crohn's, and other ulcerative colitis sort of a diseases, which actually need clinical intervention. Those have diagnostic factors, and unlike what IBS doesn't have. And those specific, following the etiology, you actually have different styles in which you can treat it for every person, which is again different. And IBS is irritable bowel syndrome. So both are actually quite different. Only the common thing is both affect the digestive system or our own, not only digestive, the whole entire gut.
So symptoms also can be overlapping sometimes and create that kind of confusion between IBD and IBS.
Yes.
Okay. So are there any special medically approved food formula like those that are there for diabetes management? So are there any special medically approved food formula for people with IBS?
No, actually not, because their symptoms are vague, like we spoke about earlier. There cannot be one shot formula. Like, for example, for diabetes, for everybody, one thing will be there that your blood sugar has risen, right? And that's common for everybody, right? So there can be made one formula which can lower that sugar. But whereas for IBS, because symptoms are vague and the confirmatory factor is not there, so no common foodstuffs as such, which is there.
Okay. Now, one more question is, how do I replace? Now, since you have mentioned about the fact that spice is not completely to be eliminated, so how do I replace my usual dietary the spice that I use in my usual cooking? What should I replace it with if I am suffering from IBS?
So there are a lot of alternatives today available also. Like say a few people may tolerate some amount of ginger. You can try the fresh one. You could try some green chilies which are non-pungent. There could be some lime which could be used. Such simple, naturally occurring foods, or lemongrass can be another way of spicing up foods. So cloves in what extent is okay, in what extent is not okay, that you can try. So various spices, India is a land of spices. You can actually pick. If nothing, turmeric always works. And in fact, we have heard of curcumin, which is so good. You can actually add it to everything and it'll help you for sure. Flavor wise, salt also.
Okay. Now, one more thing that I wanted to ask you, Foramji, was with respect to the probiotics, curds, when we talk about. Is it necessary कि homemade curd रहना चाहिए, or is it okay if you buy the packaged one, or is there any difference between the two?
Yeah, many a times what happens with packaged curls is that the microorganism which we are looking at, the good microorganisms, may not be alive. But the sustainability of that product depends on that, right? Sometimes it may get spoiled. So if the curd shelf life is for a longer period of time, usually, for example, if you keep curd at home for 2 days, 3 days, it will get spoiled, right? Over the counter one doesn't get spoiled for a few months. So for that, the bacteria is not that live. That is why it's important that you have homemade curd with that culture. If you're looking at the probiotic benefit.
Okay, okay. Thanks a lot, Foramji, for answering all our questions so much patiently. Uh, Before I come to a conclusion, I'm sorry for some technical glitch that happened at my end. Uh, okay, so we come to a
That's okay.
conclusion. Okay, so we come to a conclusion with that to this session. Thanks a lot, Foramji, for joining us and uh, answering all our questions with a lot of patience. And this was quite an extensive session, and काफी सारे doubts, misconceptions you helped us clear regarding IBS and its nutrition management. Thanks a lot to all our audience for joining, and thanks again, Foramji.